All right, it looks like we're ready to get started. I see some people may be still joining, so we're going to go ahead and kick it off. We're going to jump right in. So today we're going to be diving into the wonderful world of OT, or occupational therapy, which really is a career that's all about helping people do what they love. So I hope by the end of our time together today, you all have a better idea of what occupational therapy is and how cool of a job it can be. That's really our goal today, is to explain that to you. So before we get too far in the presentation, we would like to introduce ourselves. So I'm going to let Fran do that first.
Sure thing. All right, everyone. Again, thank you for joining us. My name is Fran Panetta, and I have been an OT for 11 years. I have mostly worked in school-based practice, working with children in preschools and elementary schools, and I've also practiced in early intervention. And what that means is working with children from birth to 3 years of age in their natural environment, so their homes, their communities, or even their daycare centers.
Awesome. Thank you, Fran.
Sure.
My name is Kyle Jones, and so I've been an occupational therapist for around 7 years now. Most of my time as an OT was spent in the hospital setting where I helped individuals just really get back to doing the things that they wanted and needed to do, and that way they could safely return home. And so today we will be talking a little bit more about those specific settings like school-based and hospital, but we're really just excited to be here today and just talk to you all about occupational therapy. So with further ado, we're going to jump right in. So we do know that this is a virtual presentation, but we would still love to interact with you all some. So feel free to comment. We have a question and answer feature available to you. So feel free to put your questions in there, and as we can, we'll answer those. I'm going to start off by asking a question right off the bat. So I'm going to say, does anyone know what occupational therapy is, or have you at least heard of it? And so in that question and answer feature, if you're comfortable, if you want to chat with us throughout, you can maybe put some things in there. But maybe you or someone you know has actually received occupational therapy before. And so you're a little bit familiar with it that way. Or maybe you're like me and you researched healthcare fields and it just happened to pop up, but it intrigued you when it did. So, regardless if you know all about it or if you have never heard of it, today we're really going to be digging a little deeper into how amazing of a career that OT can be. So let's talk about you. I want you to think of some things that you love to do. What are your favorite things to do? So when I ask you that, what just pops in your head? Think about everything that you do in a day, right? From the time that you wake up until you go to sleep. There's a lot of hours in the day and there's a lot of time to do different things. But truly, what do you love to do? So what makes you you? Sound like Dr. Seuss, right? So once again, don't be scared to comment in that question and answer feature or ask us some questions throughout. But maybe you're part of like a sports team or gymnastics or a book club, or maybe you enjoy collecting baseball cards, cooking, or binge watching Netflix series. How you choose to spend your day and have fun and live all matter and bring meaning to your life. So I want you to think about that as we go through and talk about these slides. All of those things that you love and the things that you do every day are called occupations. So those are the things that make your life meaningful. Occupations also can include the things that you need to do, not just what you want to do. So to live life independently, they all come together. These are called activities of daily living. So occupations can range from getting out of bed, taking care of yourself, shopping, texting, viewing social media, which some of us maybe do every day, all day, taking care of your pet, and then everything and anything that you do, like I mentioned, from the time you wake up until you go to sleep, which sleeping is actually an occupation as well. And for some people, it might be your favorite one. Imagine if you couldn't do those things, though. So, the things that we mentioned, what makes you you? What do you love? What if you couldn't do those things? Or what if your parents, siblings, or friends, what if they couldn't? Just think about how that would make you feel. So, just take a second and say, okay, if I couldn't do X, Y, and Z, like I love playing pickleball. So, if I couldn't play pickleball, I think that would probably affect my weekly routine. It'd make me sad, I think. So, maybe those that you love, they can't do those things because they had an accident, or maybe they're having trouble doing them because they have had a bad fall or an illness. There could be several reasons why they can't engage in those activities. Or maybe someone you know, they could do it still, but not quite to how they were before, and they might just need a little help now doing those occupations. Well, we want you to know that occupational therapy, what we do is help people do the things that they need and want to do. That way they can live a more fulfilling life. And that's the most important thing. Here's a fun example of a surfer. He had an injury resulting in an amputation, so occupational therapy professionals can actually help someone get back to surfing after they've had an injury. Occupational therapy professionals can actually help people with handwriting, to learn how to grasp a pencil properly, to form and space out letters, and to engage in school activities that they otherwise might find difficult. Occupational therapy professionals can actually help someone get back to work after they've been struggling with a period of depression. We can help individuals develop coping strategies, social interaction skills, and find their purpose again. Occupational therapy professionals can actually help people using a wheelchair. So learn how to safely transfer or get in and out of that wheelchair. If you can imagine, if you've never had to use a wheelchair before, it can probably be pretty challenging, and they would love for someone to help them learn how to use it and have maybe how to make their home more accessible, so that way they can function from their wheelchair. Have you ever thought about dressing, bathing, and being able to get to and from with a wheelchair? It might be a little challenging. I know Fran probably had to do a similar situation, but when I was in OT school, we had a wheelchair day where they gave us a wheelchair and we actually had to go around the whole day. They wanted us to go shopping and get in and out of a car and get our wheelchair in and out of the car just to see what that perspective might be like. We can help with power wheelchairs. So, like using your voice to control the chair or other special controls, for example, if they can't use their hands to steer it. We can help them live a more full and independent life while using their wheelchair. Occupational therapy professionals can also help kids and adults play or engage in leisure activities. Play isn't always just about fun and games, it also can be a powerful tool to help achieve specific therapeutic goals. A child with fine motor challenges might play with Play Doh to improve hand strength and dexterity, and that way it can carry over to other life skills. An adult might enjoy gardening, and so they can plant small seeds or trim or prune plants to work on fine motor and skills and grip strength. And a person with autism might engage in social skill games to learn turn taking and communication skills, and that way they can carry that over maybe into their school environment. Occupational therapy is holistic. So I want you to think, what do you think the word holistic means? And so does anyone, can you think in your head, what would that might mean? And so some people might think it means one thing, some people might think it means another, but really it means a lot of things. Holistic brings a lot of different things together. So we consider the whole person when creating a therapy plan. And that's what I love about occupational therapy. It's not just about one aspect, like maybe how strong they are, right? There can be a lot of other things about an individual that you have to take into consideration. So, like, what do they love to do? Their occupations. What are the physical aspects, the emotional aspects, the social, sensory, and cognitive needs? There's a lot that goes into one person. And what's great about it is each person's different. We assess their environments, their home, work, school, even their community, and how can they engage best in that area. This allows us to provide a client-centered therapy plan that will improve the individual's quality of life and overall well-being. So imagine a person who's had a stroke. This one's pretty common. People have either seen it or they've heard of it, but you may not know all aspects that might happen with a stroke. So physically, they might have weakness on one side of their body. So this might make activities like bathing or dressing pretty challenging. Cognitively, they might actually struggle with their memory and attention, leading to difficulty planning and completing the task. We get dressed every day. You put a shirt on, you get dressed, you don't even think about it, right? What if you realize all of a sudden you don't understand how to put a shirt on? I think that would be pretty frustrating. Their sensory system may need to be retrained. So their brain follows commands correctly. It may not be doing what they're telling it to do, and that can be frustrating for them. Socially, they might feel isolated due to difficulty leaving the house, or maybe their speech has been affected, and that's making them self-conscious, which really this could trigger feelings of anxiety and depression. Emotionally, the OT professional really creates a safe space for the person to express their emotions and develop coping mechanisms for that anxiety or depression that might result from the stroke. The OT might recommend modifications to the home or adaptive equipment to improve their independence. We really want them to be able to engage in the things they want and need to do. Occupational therapy professionals can work with individuals across the lifespan. This is what really excites me about occupational therapy is if you're living, then you need occupational therapy. There's something that you're wanting or needing to do, and at times you can't do it. And that's when an occupational therapist can step in. So we can work with babies in a NICU, maybe in a hospital. Maybe they were just born. We can literally work with a baby that was just born. That's amazing to me. And then individuals at the end of life. And so you can think of someone all the way from being a baby to their end of life stage. There's a lot of things that happen in your life and make you you. In occupational therapy, we like you to be you and be able to do the things that you love, no matter what stage of life you're in. This profession really is a great way to help all individuals, no matter where they are in their life. So it's often said that a doctor will save your life, but an occupational therapy practitioner will help you live it. And I love that quote. It isn't much of a life if you can't do the things that you love. Am I right? So occupational therapy professionals really do help people participate in meaningful activities that allow them to live their best life. And so you can see here, caring for a pet. There's some people, I'm not one of those people. I don't have a dog at home, but if you did and you love your dog just like it's your friend, you would love to be able to interact with it. And it'd make you sad if you couldn't, if you always did for years. And so this is just one small example of that. So occupational therapy can be found in many different places or settings, and that's what we're going to kind of go into next a little bit. It makes the job so flexible because you really can switch depending on your personal needs in your life or maybe things that you find enjoyable throughout your career. You might start off really enjoying working with kids, and then you might decide, hey, I want to switch it up a little bit. I've been doing kids for 10 years. I think I want to go work in an adult outpatient clinic now. Well, guess what? This career gives you that opportunity. So, like I mentioned earlier, I have been an occupational therapist for around 7 years, and I was in the hospital setting. And so, when I was in that setting, I saw a lot of different things. I could help people that maybe they were sick with, we saw COVID. I was in the height of that, flu, pneumonia. This can really make people sick, weak, and not able to engage in activities. Maybe they've had a stroke or a heart attack. Or maybe they had a nasty fall. I've seen it a lot with ice outside, wintertime. They'd come in and maybe they hurt their hip. And so there's a lot of things that can happen and might bring them to the hospital. But more than likely, no matter what brought them there, they're suffering from a life event that put them in a very difficult time in their life. And as an occupational therapy professional, you get to help them climb back up and learn to do the things that they want and need to do again. And that way they can return home. Occupational therapy professionals can work on horse farms. The horse's movements actually help with things like balance, strength, and coordination. Some things that we might take for granted, but a client might need those skills to be developed. Even caring for the horses can teach important life skills. This area of practice is called hippotherapy. We also can work in schools like Fran did. This is making sure everyone is at the best they can be. So you might see an occupational therapist or an occupational therapy assistant at your school, or you may even have seen one when you were younger. Occupational therapy professionals can work in nursing homes. We can help older adults, maybe even your grandparents, do fun activities, stay strong, and that way they can engage in things that they love to do. Like you can see here, dancing, singing, karaoke, playing games, just being able to take care of themselves, and live independently as possible. You actually can become an occupational therapy practitioner while you're in the military if you choose to do so. But we also love to talk about that you can also work with military personnel. So maybe your grandfather served and just you have a soft spot for that. There's actually several VA clinics and hospitals that hire OTs. You can work in the home health setting. So by visiting people's homes and helping them improve in their ability in daily activities. So sometimes they can't get out of the home, but you can go to them and help them still engage in those activities. Occupational therapy professionals can assess the home environment and really suggest changes to make it safer, like fall prevention, make it easier for them to navigate in their home and be able to do things independently, like maybe cooking. OTs teach new skills, and we provide strategies to help people reach their personal goals. So, like I mentioned, cooking, bathing, medication management. We can support family members. So you can imagine maybe if your parents are aging and you're having to help them a little more, you might want some advice from a professional that understands how to make them be safer in their home. And so we can give advice and guidance to caregivers as well. Occupational therapy professionals can provide one-on-one personalized care in the outpatient setting. So this might be if you've seen therapy before, this might be where you've seen it or you're more familiar with it. which it could be a healthcare facility attached to a hospital, a private clinic, helping clients to address their specific needs and goals, which might include like strength and range of motion, enhancing their cognitive function so they can safely engage in tasks, or adapting to changes in daily life. Like they had an injury or an illness and now they're needing to still return home by themselves, but they can't do that safely without some therapy engagement. Occupational therapy professionals can also work with people in community-based settings. So their natural environment, like Fran mentioned earlier, a child's natural environment might be different than an adult's natural environment, like a community garden, vocational programs, adult or child daycares, or even parks. Where are they actually going to do an activity? Well, why not meet them there and still do occupational therapy? Occupational therapy professionals can use telehealth services. So if you're not familiar with that, that might be like we're doing Zoom right now and we're giving this presentation to you. We might meet with a client and do occupational therapy through this type of platform. So this really can help you reach people that are in more rural areas. So maybe they're far away and they can't get to your clinic and you can't get to their home, but they still can receive occupational therapy services. And this is a really great way to reach a more wide range of clients through occupational therapy. Occupational therapy professionals actually can work for companies that allow travel around the US. And so there's various settings that you can get contracts in, all the ones that we've already mentioned. They're typically for around 13 weeks or so, but that can vary depending on the company. But there can be some exciting opportunities, like they can assist with your travel, your relocation costs, and you can see all these parts of the country while getting paid to do it. So it's pretty exciting. I know I have a few friends that are still in travel therapy, even from when I graduated occupational therapy school because they just love it that much. Occupational therapy professionals can actually help people who've had a stroke, brain injury, or other medical condition learn how to drive again. And so this can be a life-changing service for people who rely on driving for work or independence. We talked about that isolation factor. Just imagine if you couldn't drive and you didn't have family or someone near you that could take you to appointments or just out to eat or to the park or anywhere. You would want to get back behind the wheel, but you would need to be able to do it safely. And that way you don't cause harm to yourself or others. An occupational therapist can help you do that. This is a very timely slide because what this is going on, but NASA has actually been looking into occupational therapy to help astronauts maintain their physical and mental health during long duration space missions. This is a very new and exciting area of practice for occupational therapists, but we just thought that this would be fun to mention. So here's an even extensive list of other places that occupational therapists can be involved in. Like I mentioned, if there is people there doing things, occupational therapists most likely can be in that space. So as you can see, OT is a very flexible and fun profession. There's something for everybody. And if you thought it was for you and then you decide it's not, you can switch it up. And that's what's so wonderful. So now I'm actually going to pass things over to my colleague, Fran.
Perfect. Thank you, Kyle. So I just want to reiterate there is a Q&A feature and you can put in some questions you might have, whether it's about OT practice. Kyle and I have very different clinical backgrounds as we discussed earlier, so we're able to cover a lot of ground. So if you have questions, we're happy to address them later on, but you can enter them in now. And I know that Bobby from HOSA is also here on the call, so if you have questions about HOSA, you can go ahead and enter those in the Q&A feature as well. So, building off of what Kyle just shared, as an OT professional, there are so many places that you can work in, and there's so much that you can do. You can be a clinical practitioner, of course, a researcher, a professor, an advocate, an entrepreneur, a CEO, or an influencer if you love social media. And next slide, please. And really, there is so much more where there are people, as Kyle mentioned, there is a need for occupational therapy. So there really are so many possibilities in this field. Next slide, please. So you might be thinking, what type of person is best suited for a career in occupational therapy, or what does it take to become an occupational therapy practitioner? So I'm going to go over some qualities that are good to have when working in OT. Next slide. So, first and foremost, if you love interacting with people, then this is a great fit for you. You have to like people to get into occupational therapy. You need to be a people person. That's really the whole point of our job, to help people live their best lives. Whether with kids or adults. We mostly work with clients in one-on-one or small group settings, and you'll need empathy and compassion, understanding and acknowledging the challenges that clients face, and showing genuine care for their well-being. Next slide, please. If you like thinking quickly on your feet and problem solving, this is a good fit for you. I often needed to think really quickly on my feet as a school-based OT, working with resources that I had on hand. The ability to analyze situations, identify challenges, and develop creative solutions to help clients achieve their goals. Being a creative problem solver is really valuable in this profession. Next slide, please. Excellent communication skills, the ability to clearly explain diagnoses, treatment plans, and recommendations to clients and their families is really important. And it's important to do this in an understandable way, making it easier for them to understand what's going on and what they need to do and how to get to where they want to be, how to achieve their goals. And with that comes active listening skills, right? So giving clients and their families a really safe space to express their needs, concerns, and goals, like Kyle mentioned earlier. Next slide, please. Patience and a positive attitude. Recovery can take time and often doesn't happen overnight. And a good occupational therapy professional needs to be patient and supportive throughout the whole treatment process. Next slide, please. Adaptability and flexibility, being able to adjust treatment plans and approaches as needed to meet the unique needs of each and every client that we serve. So this goes back to what Kyle talked about earlier with holistic care and what makes OT so unique, since we really take a deep look at what really matters to the client. Next slide, please. Teamwork and collaboration, working effectively with other healthcare professionals, families, and caregivers to ensure coordinated care and to make sure things run as smoothly as possible. Next slide, please. Lifelong learning. So the field of OT is constantly evolving, and that's what makes it so exciting. And a good occupational therapy professional is committed to ongoing learning and professional development. So this really just helps ensure that our clients are receiving current, safe, and effective care. Next slide, please. And cultural humility, so understanding and respecting diverse cultural backgrounds and beliefs to provide culturally sensitive care. And this is really important for our clients and their families. You'll be working with people from different backgrounds, and it's just something that's really important to have. And personally, I found it really important as an OT working in various communities in the greater New York City area. Next slide, please. Now, if you think this is a good fit for you, you should know that there are two different career paths in occupational therapy. You can be an occupational therapist, an OT, or an occupational therapy assistant, or OTA. And I'll spend some time talking about each of these different pathways. Next slide, please. So what is an occupational therapist, or OT for short? So we'll go over the definition for that. Next slide, please. So as you can see here, an occupational therapist, or OT, assesses and designs interventions to enhance independence and overall well-being. Next slide. So what's an OTA then? What's an occupational therapy assistant? Next slide. An occupational therapy assistant, or OTA, works under the supervision of the OT to implement those interventions. Next slide, please. Something worth noting is that you don't actually need to be a science major to be an OT or OTA. It may help with prerequisites or required courses, but it's not required to major in a science background. Next slide, please. So here is the pathway to becoming an occupational therapist. You'll need to start with an undergraduate degree, and then you can explore OT graduate programs. So you can either get a master's or doctorate. It needs to be at a graduate level. So once you graduate from one of those programs, you will need to take and pass the national board exam. So here in the United States, that is from the National Board for Certification in Occupational Therapy, or NBCOT, and you would earn the OTR certification and be able to obtain a state license to practice. So again, this is the pathway for becoming an occupational therapist in the United States. Something worth noting as well is that there are some accelerated programs that exist. So, for instance, I completed a BSMS program, and there are also some BSOTD programs as well. So, that is also an exam or other types of programs that you may be interested in if you know that you want to pursue OT. Next slide, please. Again, as I mentioned before, you can major in any field that you want. You just need to have the prerequisites that are required to get into OT or OTA school. So some people do their undergrad degrees in health sciences or kinesiology, and then some students might decide to major in art, theater, or music. So lots of options there. Next slide, please. Now, here's a pathway to becoming an occupational therapy assistant. You can earn an associate's or bachelor's to become an occupational therapy assistant or OTA. Once you graduate, you will need to pass the NBCOT or National Board exam as well and earn your COTA certification. Again, this is what would allow you to obtain a state license to practice. Next slide, please. So in terms of employment, the U.S. Bureau of Labor and Statistics reports that employment in OT is expected to grow. So by 11% for OTs and 21% for OTAs by 2033. This is a great indicator of job stability in this field. Next slide, please. Also from the U.S. Bureau of Labor and Statistics, in 2023, the median salary for an OT was around 96K, and then for an OTA, just over 68K. So just keep in mind that this can vary a bit by work setting or location, like city and state. So there are some varying factors there. Next slide, please. Working in occupational therapy provides meaningful client relationships, which results in rewarding work. You get a great work-life balance by choosing where and how you want to work. I know Kyle mentioned a couple of these examples earlier, but I know that some OTPs or occupational therapy professionals work per session for a more flexible schedule. That's what they prefer. Personally, as I mentioned before, I love working with kids of all ages. So I would work as a school-based OT during the day and then pick up some early intervention sessions after school hours or pick up some more during the summer break. I also know some occupational therapy professionals that work at schools during the day and then occasionally work per diem in hospitals or skilled nursing facilities. So there's a lot of options there. And the field, as I mentioned before, is constantly evolving. You get to work in so many different settings. There's so many options. As talked about earlier, there's really some unique settings that you can work in. So really every day is different and allows you the opportunity to make a positive, wonderful impact on someone's life. You'll never get bored. And in OT, you don't have to take more, you don't have to get another degree to switch from working with kids or adults. So that's something that is also really important to know as well. Next slide, please. So here's just a few examples of OT changing lives. So this first example is helping a teenager reclaim his independence after a spinal cord injury. I believe this video is a little bit long, but we'll let it play out. I don't think it'll take too much time. So as you can see now, the teenager is able to use a wheelchair effectively to be able to get from place to place, able to tie his shoes again. The second video is OT helping individual with dementia live as independently as possible, which is really great. And then, yes, this last one is my favorite. So that last video, OT is helping someone who has suffered from a traumatic brain injury or TBI learn how to do everything all over again. So again, the impact and the way that we're able to change people's lives is huge. Next slide, please. So we recently partnered with influencers who share their experiences with OT. They've had firsthand experiences with OT, receiving OT services, that is, and the meaningful impact that OT has had on their lives. So we'll take some time to go through each of their stories. So in the next slide, we will see Sarah Todd, who is 24 years old. And she has acute flaccid myelitis, or AFM, and which is a neuroimmunological disorder caused by a viral attack on the spinal cord. She has regained the ability to walk, which is great, but she still has some partial paralysis in her arms and hands. She uses her disability inclusion and accessibility expertise paired with her lived experiences as a disabled individual to educate other individuals, and businesses on how to create and foster disability inclusive products, services, and environments. So I'll have Kyle play the video to share Sarah's story.
I am so excited to partner with Why Choose OT to encourage you all to pursue a career in occupational therapy. Because of my physical disability, I can't reach my hair, so I wasn't able to wash my hair independently until my occupational therapy practitioner helped me design my very own adaptive bathroom. She worked with me on all the details to ensure I could be as independent as possible, so let me take you on a tour. Firstly, we installed a touchpad to help me turn the shower on and off and adjust the temperature. Next, we put a niche in my shower with a shelf at the exact right height for me to put my elbow on it so I can reach my hair to wash it. We also installed a ledge for me to shave my legs more easily to reduce risk of falling. This counter by my sink is higher so that I can put my elbow on it to reach my hair, to brush my hair, and I can reach my face to do my makeup, and I can also use it to put my clothes on and take them off over my head. Without my OT, I would not have my adaptive bathroom that provides me with independence and joy that so many people take for granted. I know getting to see the positive impact her work has had on my life fills my OT with happiness. If you want to build personal connections with people and make a positive impact, I highly encourage pursuing a career in OT. Who knows, maybe one day you'll be the reason that someone can live as independently as possible.
Great. Thanks, Kyle. And I hope that you enjoyed Sarah's story. Next slide, please. So now here's Joey. He is a food blogger and he's based in the Northeast. After a head-on car accident in 2024, he had a traumatic brain injury. Again, that's also called a TBI. He's had to relearn everything from walking, cooking, getting back to holding his camera and making these recordings, which is his favorite occupation. He credits OT for helping him live his life again. And Kyle, you can go ahead and play this video. Thank you for sharing that. And so that's Joey's story. And you can always view these on our social media, which we'll talk a little bit about later in a few slides, if you want to revisit these stories and see them again or share them with others. Next slide, please. And here is Mason at the age of 17. He was a junior in high school. He was captain on his varsity soccer team. He was the fastest 400 runner on his track team. He enjoyed making art, being social, and getting outside as much as possible. He was really passionate about that. During COVID in Minnesota, he went out for a normal day of downhill skiing and he decided to go off a jump. Seconds later, unfortunately, after he landed on his back, he burst his T12 vertebrae, which immediately compressed his spinal cord and unfortunately left him paralyzed from the waist down. So now Mason shows the world what is possible for those with and without disabilities, and he's very active on social media, as you can see. And Kyle, you can go ahead and play the video to share Mason's story.
Do you want to help people in a meaningful way, but don't know what job actually allows you to do that? When I got paralyzed, I had to relearn everything: how to stretch, how to cook, and how to live independently. That's where my occupational therapist, Maria, came in. OTs help people get back to everyday life after injury or illness. She helped me problem solve and navigate my new body. We took on challenges together, whether that be getting dressed, learning how to transfer, or using the bathroom. We were a team. Most importantly, she made it fun and light, something I desperately needed at that time. Maria's joy and energy were contagious, and I realized it came from how she works. She doesn't just treat injuries, she sees the whole person, what they've lost, and what's still possible. And that's what OT is. It's about finding what lights people up and working with them to bring it back. Whether that's playing your favorite instrument again, cooking your favorite meal, or making art with adaptive tools. Whether you want to work with kids, artists, athletes, or veterans, OT gives you a way to work with them and make a real difference in their lives. If you're someone who wants to help people and you're still figuring out how, OT is one path worth looking into. Check out Why Choose OT. It might just be your thing.
We hope you enjoyed Mason's story, and I think we have one more story to share with you. Next slide, please. And now we have Jake. He was diagnosed with a terminal brain illness, acute toxic progressive leukoencephalopathy, which left him in locked-in syndrome for 10 months back in 2017. OT was central in helping him rebuild his independence. You may have possibly listened to his true crime podcast about what happened to him while he was in the hospital, fully conscious, but no one knew that he could hear them. Kyle, if you could play the video, please.
I'm Jake. I can't believe this video is of me. I was stuck in my own body like that for 10 months. I had something called locked-in syndrome. And look how far I've come thanks to all my occupational therapy practitioners.
Same thing to put it down. Don't let that form rotate right here and then back up. Yes. Can you hold it here? Turn your wrist. Ready? You scoop. There's a lot in that wrist. Pull your lips off it. Yes. That was good. Almost like wiggle through it. Like point the tip down and then the back down. Curl those fingers up. And pull it in. Yes. Ta-da!
Oh my God.
Told you.
Severe ataxia no more?
No. Look at that control. Can you close your legs together? Like so that if they fell, it doesn't go on the ground.
I'm gonna take some steps and hopefully not fall.
Thank you for playing that for us, Kyle. And we hope that you enjoyed hearing Jake's story and seeing OT come to life. Next slide, please. So as you hopefully could gather from our conversation and the stories we shared with you, OT can really help make a difference in someone's life every day. And, we love our field and hope that you fell in love with it a little bit today yourself. Next slide, please. So if you are interested, you might be wondering how you can prepare for a future in occupational therapy now. So you can shadow an OT or OTA. You can volunteer in settings where occupational therapy happens so you can witness it firsthand and be a part of it. And some or many OT and OTA programs actually require that you have this shadowing experience. So that is something to keep in mind as well. But yeah, just so you can have some more exposure to the field, that would be great. You can research schools. You can start looking to see where you might like to go and what prerequisites are required. And you can also find a mentor. There are many occupational therapy professionals who would love to help you discover this amazing career some more. And resources and tips for all of these can be found on our website, whychooseot.com. Our school directory, we do have our own school directory there. It features program social media accounts. So that could be a fun way to learn about programs too, if you're interested. Again, that can be found on our website, whychooseot.com. Next slide, please. And we suggest that you stay connected with us, learn more about occupational therapy by following Why Choose OT. We are active on pretty much every social media platform that is out there. And again, you can see those same stories that we share with you and more. You get to learn more about different practice areas in OT, different settings you can work with. And it's just a great way and fun way to learn about OT. Next slide, please. And again, as I mentioned before, you can find the information that we've discussed and more on our website, whychooseot.com. I know we also have features like OT in real life or OT IRL, and you'll get to see some more, hear more about OT, and you get to hear from different OT practitioners about why they chose OT or why they love the field. So a really great resource to learn more about this wonderful profession. And thank you so much for letting us spend time with you today. I know I see a couple of questions came in the Q&A feature, so Kyle and I will take some time to address those. And if you have any more questions, if anyone didn't have a chance to enter in their questions, you can go ahead and do that now, and we'll work through that for the next couple of minutes. So I think I can
Yeah,
start
we
the
can.
Q&A. Yeah, so we can get started with that.
Yeah. If you see any that jump out at you, Fran, I wanted to the very first one was kind of towards the beginning, and it's a very common question. So I just kind of wanted to address that one for sure. It says, is occupational therapy the same thing as physical therapy or different? So they often do get confused. And I know when I was looking into healthcare, I initially knew about physical therapy, and so I typed in therapy in schools, and I got introduced to occupational therapy, speech therapy, respiratory therapy, physical therapy. There's a lot of different options out there, but just today you learned more about occupational therapy, and I just wanted to do a specific difference between physical therapy and occupational therapy. We really broke it down and talked about occupation. So, what makes you you? What are the favorite things that you enjoy doing every day? What do you need to do every day? You need to be able to take care of yourself. But after you get past those basic necessities, an occupational therapist is really helping you engage in all aspects of your life. And so, one example I know in the hospital I would always give is I was really in charge of self-care. So I'd be like, I'm your occupational therapist. I'm really here to help you with your bathing, dressing, toileting, being able to make it. And so you just really break down depending on what setting and just being able to explain what you're doing in that area. But I would always like to say a physical therapist can help you get there, right? They're really helping you with your mobility, maybe the strength and range of motion. But the occupational therapist comes in and helps you with what you're doing once you're there, right? You can walk to the bathroom, but what are you going to do once you get there, right? Do you need to get into the shower? Do you need to brush your teeth? Like, what are the things that you need to do when you get there? And so that's how you kind of can break it down is what is each discipline really focusing on? Because they can overlap a little bit. But that's kind of one fun example I like to give.
Yes. And just to add to that, another good reason to follow us on social media is that we do um, talk about things like this. So we have a post that's called OT and PT, What's the difference? And on one side, it talks about OT and how it helps you live your life, and PT helps you move through life, and gets into a little more detail than that. But there's lots of good and useful information that's presented in a way that I think makes it um, easy to understand. And it is a good question. I know it's people often ask us, how is OT different from PT and speech therapy, as Kyle mentioned. So that is a great question. But yes, we do have some information about that on our website and our social media as well. So I did want to take the question about what might occupational therapists do in the NICU, which is a great question. And so when a baby is in the NICU, they're really fragile, and so they may need help with positioning for feeding, or they may need help with sleeping. And another component of working in the NICU is that you really have to communicate and work and partner really with the caregivers or parents that are involved, and the support that they may need. I mean, it can be difficult to have a baby be so fragile in the NICU, and so you want to be there to support them as well, and make sure that they're doing okay as well. And then I see a question here. Can you guys talk about specific schooling and what college programs and undergrad majors are best? So I think we did address this in some of the later slides. But for different schools, we can't speak to certain programs, but we would recommend that you go to our school directory on our website, whychooseot.com, and you can check out different schools for OT and OTA programs, and also filter through the degree levels. So you can filter through associate, bachelor's for OTA, and then master's and doctorate for OTs.
Yeah, and I wanted to add a little bit to that.
Sure.
So, depending on what school you decide to choose, it might come down to the prerequisites. And so, you're
Mhm.
looking at different schools, and there's lists of classes essentially that you have to take to be able to get into that college. And so, different degrees that you pick for your undergrad, like Fran mentioned earlier, might give you more flexibility. You might have more options to pick prerequisites as electives, they call it. And then there's other majors that maybe you don't have as much wiggle room to add extra classes. So you might have to tack them on top of what you're already doing for that major. So some people pick different majors depending on the flexibility, or maybe some of those prerequisites are already built into the major you pick. And so that makes it easier for you because then you can pick other classes to take of those prerequisites to add in, but some of them that are built in, you won't have to add as much to that degree as you would another. So anyway, there's a lot of different options out there. In my class alone, I had about 48 of us in my occupational therapy graduating class. We had, like Fran mentioned, a music major. We had a biology major. I was a kinesiology major. We had an engineer. And so people decide even while they're in school, they might be thinking they're going one route and decide they want to do OT. So just know that you can't pick wrong, but you might be able to set yourself up for a little more success, is what Fran's kind of mentioning if you do that research earlier on.
So I see a question here that says, if we are still in high school, is there anything we can do to get started? So as we touched on in the presentation earlier, a good way to get started is to shadow an OT professional. And if you go to our website, there's a tab. So our website is ychooseot.com. There's a tab called Become an OTP. And then there's actually a section called the Application Process Overview, and it contains many useful resources to walk you through different steps of applying for school, writing a personal statement, how to go about shadowing an OT professional. There's templates you can use when you're trying to reach out to an OT professional. So that's a good way to get started, and just know that there are resources there for you to support you throughout that process.
Yeah, I like that one. There's one kind of like right above it that also talks about college. So it's very similar. It's like, what can I do in high school or college? And to Fran's point, yeah, like when you're in high school, you might just call an outpatient clinic or just where occupational therapy is happening and just ask them like, hey, I'm a high school student interested. Could I just come observe? And maybe their clinic is open on a Saturday, or maybe you can go from 4 to 5 after school. So you can take the initiative even if you don't find it exactly on a list, whatever is local for you. In college, I actually used to hire college students at my hospital because we would need therapy techs, is what we called them. They actually were the ones helping the therapists get the patients up and move them and go get equipment that we needed to interact. And that looks great on a resume. So that's a good example for college is you could maybe work like 1 day a week or on the weekends every other weekend. That's just a couple examples for high school and college.
Great. Thanks, Kyle. I see another question here. What does life look like for a travel OT and what does it consist of? So I personally haven't done travel OT, but I know a lot of, like Kyle, I know a couple of colleagues who have done it and just swear by it and love it. So I have I have some friends who were able to explore living in different parts of the country and really enjoyed it. And what typically happens is that they'll partner with a certain agency or company and they'll help them get placed in certain hospitals or schools that they like. And you would then have to possibly relocate for a little bit. I think the contracts are typically 13 weeks. Sometimes they could be longer or shorter. It really depends on what the need is. But they do provide some assistance from what I gather and know. And that may also include help paying for state licenses in different states if you haven't practiced there before. But then the next step is figuring out where you want to go next. And maybe you want to stay nearby or work in a different place. You can work with the agency or company to do that. But I also have friends who said, hey, I want to take a month off from travel and spend some time with my family. And so they were able to do that. So it is pretty flexible and they really enjoyed exploring different parts of the country. I have one friend who has always lived on the East Coast, but then she got to do travel therapy and she was based in California and she fell in love with it and ended up working there full time. The school needed an OT full time and she was able to get that position. So it's a great way to explore and could open the door for more possibilities for you. And then let's see, we have a bit more time to answer a couple, so we can go ahead and read through some more. So I see a question here that says, does it take more training or specialization to work in pediatrics as an OT? So you wouldn't need necessarily more training or specialization after you've gone through school and passed the board exam and gotten your state license. But it is possible that you might be interested in something more specific within pediatrics. So I know some individuals who are really interested in certain handwriting programs and they would pursue more training in that. I did that myself as a school-based OT. So there might be certain courses or additional training that you might be interested in, but it's not required. There's quite a couple here. Did you want to try to pick one or two, Kyle?
Yeah, I'm actually loving everyone's responses here. So there's actually two in a row, like two
Okay.
questions, but it says, what is the hardest part of being an occupational therapist and what is the hardest part of your job?
Oh,
Those are two really difficult questions, I would say, because it depends on where you're working. I
mhm.
would say the hardest part for me with that when I was in the hospital is that not everyone's going to recover at the same pace or be able to fully recover from their injury, accident, life event. And I think that's the hardest part because we all want everyone to recover. We showed you those lovely stories of all these individuals that either they recovered or they're learning to live their life with the accident that happened to them or the injury or the diagnosis that they not now have. And so maybe people don't take it very well. They might get depressed, or you want them to improve really badly and then they don't. And so that was what was really hard for me is learning to just know that you're doing the best you can as an occupational therapist, but not everyone's going to be able to recover. And so you're going to have stories of those awesome success stories, and just know that comes with that as there's sometimes that involved as well. So I would say that was the hardest part for me when working in the hospital, but it could vary depending on and where you're working and who you're working with. And I know Fran might say, I have friends in pediatrics. Sometimes it can be the home life of the child. You could be at school, it could go perfect. You have the perfect scenario set up, the environment's working, but then they go home and they maybe have a troubled home life. And that can be hard for you to see as well. So that might be a few answers to that.
Mhm.
Let's see. Yeah, some of these we've answered here. A lot of you are asking about like the majors or what you should be looking for when you're looking at colleges, and I think we've kind of answered that. Like you're really
Mhm.
looking for maybe cost is what you're looking at, what the prereqs are. Are they nearby? Would it be in-state or out-of-state tuition? Those are all kind of things that you might want to consider, and what major you pick. Yeah, I think do you see growing in the future? Yeah, and someone said, "Do you see this career growing in the future or changing in any way?" And so I think Fran did a great job at describing that. That there's already data and statistics out there saying. So I know you probably have heard of like the baby boomer population, or so the U.S. population is expected to be older. And so as these years go by in the next 10 years or so, and so that's why occupational therapists probably might have a more need, and there's going to be more people needing occupational therapy or help living their life. And so we do see the future of occupational therapy being bright, and the fact that there's going to be a more need for us. And so we would love for more people to fill those shoes, and that could be maybe you. Fran, is there anyone or any other question that you see that maybe we didn't address or might be good?
Let me double check and make sure I didn't miss something. This is a fun one. Personally, what were the most important skills you developed while working with clients? So
Oh,
that is a good one. It's a fun way, I think, to end the night. Um, for me, I would say patience and flexibility. So, working with children with special needs and their parents, sometimes it can be challenging at times. I mean, it was so rewarding and I loved every second of it, but not every second was easy. So I definitely was patient with others and myself. And yeah, with flexibility, I'm a huge planner and I love to plan out like most things that I can, but you can't always control things. Sometimes you have to think quickly on your feet, or maybe uh, for me, maybe I plan to take a kid out for um, help a kid during recess, for instance. But then there was a fire drill that took 20 minutes, and I couldn't. And there's a lot of flexibility. You have to think quickly on your feet, or maybe, something didn't really work out the way that you thought, or there's a major change in schedules, or maybe I couldn't access a room or certain equipment that I wanted to. Um, yeah, learned how to be flexible and patient for sure.
Yeah, and I would say just remembering that they're a person. And so you're going to have goals, deadlines, notes to write,
Mhm.
documentation to put in, just expectations from your employer. And sometimes it can be really easy to get away from what's important to that person. And I think today we've really harped on and helped you understand that occupational therapy is all about what's important to that person, what do they need and want to do. So just remember to make occupational therapy fun and to have fun with it and remember why you even got into it and why you enjoy it. Because I do know as I got farther along in my career, there'd be days where I would sometimes just be going through the motions. And I want to encourage you to just remember to always go back to your why. So, why did you choose it? Why do you enjoy the job? And so, just remembering that with each client, like make part of your session every day fun. And so, that I think will make you enjoy it more. All right, I think we're right at the end of our time.
I
So,
think so.
yeah. All right. Well, thank you everyone for tuning in. We really enjoyed being able to visit with you today. We certainly appreciate you giving us some of your time and being able to listen in. And we hope that you visit whychooseot.com and consider occupational therapy as a career for you.
Thank you.